A way to assess if this is going to be effective technique for you is to notice, do you have one shoulder that's really dropped? Usually it's the right side shoulder. And is there a rib flare that's sticking out? So when you look at your bare skin, is there a rib that sort of really juts out here? That's called a rib flare. Some people have it rib flared on both. That's to do with the PEC pattern mostly. On the left side, it's the left AIC pattern. It usually corresponds with a lowered shoulder on the right and ribs that roll inwards too and are held down. How you open that is to work on the rib flare here, which makes air be shunted up into here. If you're someone who gets a lot of pain, tension through the rhomboids, back of the shoulder blade, up into the neck here, similarly by no reason or just lots of work, this will be extremely effective for you. So you can do on both sides, but you're doing twice as much on the laying down on the left-hand side if you've got the issue on the right side. And the way you can test is just how does that feel? Test neck turn both ways. Is one more restricted? Do the exercise, do 3 sets, laying on the left side, then lay on the right side, then lay on the left side again, then retest. Is that easier? Has the pain gone? And usually it has. So this exercise is to help with a rib flare. Most people have a rib that flares out, it kind of sticks out on the left side, which then makes the upper few ribs on the right side depressed and be held down. And it looks like a shoulder that's dropped on one side and usually rolled inwards. So how you open that up, there's a few different ways. One is to get the rib flare away from here so the air can naturally be shunted up into here. And it opens up and decompresses this area here. So that's what we're going to do here. How you set it up is important, the body position. So I've got my knees bent up 90 degrees at the knee here too. Feet touching a wall. So there's a sense of ground, it's like the wall acts like the ground. So it's a way of grounding neurology through your body. I've got a rolled up towel underneath about the level of my nipple here. So it helps compress the ribs on this side here and allows air to expand in the front and back of my chest. So it expands this way. Really important you relax your neck. So I'm relax my neck using my hand here. And now what I'm doing, I've got my hips stacked on each other so they're not back or forward, just stacked on each other. Shoulders are stacked on each other, I'm not rotated at all. And I'm pushing my bottom hip into the ground. And when I do that, it makes my obliques here on the bottom contract, so we want that. So we get that contraction. It's maybe about a 3 out of 10 effort, it's not much. And then I keep that contraction there. Bring this arm over the head. I'll just let the arm just rest over the head. So this is now opening up this space. And then I'm breathing. So I'm breathing nice and easily, silently through the nose. And you'll feel the air expanding this area in particular. Well, I've still got here a bit tight. And as I breathe out, all the air out, like you're fogging up a mirror. You'll feel the side abs engage and engage more on this side too. Then I'll breathe in again, let it inflate everything on this side here. So we get all the air out, and then I hold for a count of 3. 1, 2, 3, breathing in silently. We're doing 10 breaths.